Thank you. It's such a pleasure to be here with you this afternoon. My name is Danielle Bonadies from my Gene Counsel. I'm a clinical genetic counselor by training and worked in hereditary cancer clinic for many years. And as a genetic counselor, we saw some challenges in the field. One was trying to be able to scale genetic counseling information to individuals who needed that information, when they needed it and where they needed it. And then we also saw challenges in recontacting those patients as things in the field changed, whether that was variant reclassifications or updates in their medical management. And with those challenges, I and a few colleagues founded my Gene Counsel, which is working to solve some of those issues. How do I advance to the next slide? This one? Thank you. And my conflicts of interest. But I wanted to speak today, of course, about direct-to-consumer testing. And so we've seen these numbers earlier today, that 26 million have now had this type of testing. And I'd like to look at it as a daily number. So this is 42,000 people every day, and this is actually the size of the town that I live in. So every day, my town is having direct-to-consumer genetic testing over and over throughout the year. And projections are that this will reach 100 billion, as we heard earlier as well. But one of the interesting parts about this statistic is that for those who are concerned about privacy or data privacy, is that really the genie is out of the bottle here. Because with these numbers, if you take a look at the US population, which is just over 300 million, this is really a third of the US population. So whether you have had a direct-to-consumer test or not, it's likely that one of your relatives, even if somewhat distantly removed from you, has had a direct-to-consumer test, and therefore some of your data, by being genetically related to them, is in that database. And so what we saw in our clinic and what we see today with patients that approach us is that after they've taken one of these tests, there are many residual questions. So I've spent money on this test. What was tested for? What wasn't tested for? What do I need to do next? Do I take it to my healthcare provider? Are there implications for my own medical management? Where do I turn next? And we can see this also in popular press as well. Online gene tests find dangerous mutations, genetic tests ordered by doctors, is direct-to-consumer testing accurate? And we can see this also if we take to social platforms. So, you know, this is on Twitter saying that 23andMe will tell you if you have a BRCA mutation. Quotes like "this saved my life." It's a wealth of important genetic information, and patient advocates clarifying some of that information, that 23andMe tests for 3 out of over thousands of BRCA mutations. Others saying a negative result from 23andMe is not a negative BRCA test. So there's a lot of conflicting messages that consumers are getting, whether it be in the press or on social platforms. And what we've seen is that in some cases, the medical or the direct-to-consumer model is really that of a transactional model. So there's marketing efforts, saliva collection, genetic testing, result disclosure. But then things like family history assessment, verification of testing, medical management changes, risk and medical management discussions, as well as long-term care and surveillance kind of fall off the cliff. So what are some paths to integrating this data into the medical model? So one path might be verification testing. Another might be some of the direct-to-consumer, more medical-grade testing options. And then I'll touch upon some other trends. So this is data from one of the large genetic laboratories, although it's a very small patient population, just under 50 patients. But this was data on direct-to-consumer tests, whether it be done by some of the large testing companies that you've heard of, or some of the third-party interpretation services. But what they found is that 40% of those results were false positives, with close to 60% of those being confirmed. Of the false positives, you can see some of the gene names here, CHEK2, TP53, the BRCA genes, ATM, MLH1. If these genes are Googled, those consumers will find significant impacts to their medical management, which would be very confusing. So these are, on the left-hand side, some of the confirmed variants that were found through this research project. And the three on the top are the 3 common Jewish mutations, which there are high concordance rates from direct-to-consumer testing, and then those being confirmed. The ones on the right are the false positives. So these are many of those mutations and variants we saw on the previous slide. And then interestingly, of those variants that were confirmed, there was also a large percentage, almost 20% of them, that although they were confirmed, the impact and the implication of those variants from what the direct-to-consumer test had revealed to what that genetic medical grade laboratory revealed were quite different. So you can see in the third column, the DTC or third party classified these variants as increased risks, but then this medical laboratory classified most all of these as benign. So again, quite significant in terms of impacts to risks. So what wasn't covered in this particular study, but which other laboratories are now attempting to cover, are those individuals who have significant personal or family histories of breast cancer. And so although this data is not published yet, it was presented at a conference recently, and this laboratory looked at their database of individuals who had strong personal or family histories of breast cancer or ovarian cancer. They also looked at colon polyps and colon cancer history. And they looked at all of the positives. And they said, okay, out of all of these positives, how many of these positives would have been found if these consumers had done a DTC test? And they found that, depending on the ethnic background, but between 80 and 90% of them would not have been picked up on a direct-to-consumer test. So we are missing quite a large number for consumers who are having direct-to-consumer testing. That said, there is still some significant data for these soon-to-be 100 million people that are having direct-to-consumer testing. And so before we throw the baby out with the bathwater, there are some routes into incorporating some of the significant and valid information that we can find from these tests. So one of the projects that my company is working on is building a bridge from DTC testing into medical grade and the medical system. And so we are offering genetic counseling and verification testing to individuals who have a direct-to-consumer finding, who want to get it validated, or who have concerns about their personal or family medical history, such as a strong family history of breast or ovarian cancer, colon or uterine cancer, and if they're candidates for genetic testing and counseling, helping them through those routes. And this was one of the ads that we developed in combination with our consumer advocates to approach those individuals who were interested in ancestry information. So you know where you're from, but do you know where you're going? So transitioning from some of that ancestry into health-related and medical grade testing. And there are several forward-thinking insurers who are now covering verification testing, particularly for the BRCA genes. Blue Shield of California, Anthem, and Aetna, which are, as you know, large insurers. And it really allows not only the insurers, but also the patients to take advantage of this information that is already available and accessible to them. So the second kind of trend that I'd like to discuss is direct-to-consumer testing in the medical grade setting. So there are now several laboratories which are offering this type of testing directly to consumers. We heard about some of the hybrid approaches this morning, but there are several opportunities for consumers who are interested in this. Some of the trends that we've seen in the industry is that although many of the laboratories launched these programs several years ago, many of them are now pivoting away from a one-on-one interaction with a patient to doing more population testing. And so this type of approach may be harder for consumers to consume. There are also research-grade testing options that are happening not only within academic medical centers, but of course across the country and internationally. Many other countries are doing large population testings. But this leaves our providers, our healthcare providers, our physicians, our nurses, our genetic counselors, to then assess what type of testing was done, was sequencing done to confirm that pathogenic variant, to elucidate the personal and family history to see if additional genetic testing is still needed. And so we still are putting that burden on our providers and need to offer them tools. So as trends in the industry, we've seen that direct-to-consumer testing is, of course, exploding. We've also seen the global genetic testing market will soon reach $22 billion, also exploding. There's large population genomic studies, the gene panels are ever increasing, and of course, genetic research is rapidly evolving. And so as additional information is learned about new genetic associations, or we go back and learn, for example, that pancreatic cancer was associated with BRCA mutations, how do we reach back out to our patients, and how do we notify them of those updates in the field? Our group looked back over the past 5 years at the 59 genes that the ACMG has identified as important for individuals to know if they have a pathogenic variant in those genes, and we found over 600 changes in their medical management just within 5 years. And so the medical system isn't well set up to recontact those patients and to keep them in the loop about their ever-evolving medical management and how they need to be followed. And so I'll propose one vision for the future, and that's of long-term engagement. So offering verification programs, tools for healthcare providers, accessible and scalable genetic counseling and digital information, gene and variant-specific reports. Those reports should update over time and have notifications related to changing variant classifications, as well as the medical management updates, comprehensive searchable resources, and then focus on engagement and retention of those consumers, as well as their healthcare providers. Thank you.